I would like to thank the organizers for the kind invitation. I'm happy to present on the study of coronary atherosclerosis using blood residence times. Javad, the first author, is my fellow, and this was in collaboration with Bifurcation and Yanni. So coronary artery disease, as you all know, is the leading cause of death in the U.S. with over 800,000 deaths annually. Certainly, stent placement is performed in up to 90% of the cases in the over 1 million percutaneous coronary interventions in the U.S. The stent coronary bifurcations are about 20% of all cases. About 15 to 20% of the stented coronary bifurcations fail between 6 to 1 year post-intervention. This remains to be high relative to stenting straight segments. Now, restenosis depends on various physical and biochemical factors, including blood residence time, where high residence times provide greater time for both inflammatory cells, cholesterol, and other biological species to engage the vessel wall. The objective of this presentation is to calculate blood residence time in atherosclerosis, atherosclerotic patient vessels using residence time method, abbreviated as RT. We also plan to compare the RT with relative residence time, which is the more conventional method. We also intend to visualize the flow pattern and zones with high risk of atherosclerosis using the proposed residence time method. The approach consists of taking patient-specific coronary angiograms, doing segmentations to reduce the 3D geometry, including 3D reconstruction. We create meshes from those geometries, and then we utilize computational fluid dynamics to compute the parameters of interest. 3 subjects were considered. 1 subject was normal with fractional flow reserve greater than 0.96, so no stenosis. 1 patient had a functionally significant stenosis with FFR less than 0.66. And then 1 additional patient C, we considered both the LAD first diagonal coronary bifurcation before and after stenting. The residence time method has been introduced and elaborated on previously by our group. We essentially use an advection diffusion equation as stated by equation 1. C is the concentration and U is the velocity of the flow. And then from that, a scalar blood residence time is defined as the integral as per ratio of integrals as per equation 2. And then if you combine equations 1 and 2, we come up with the field equation that allows us to solve for the scalar blood residence time defined as A here. This shows some color schematics of the various simulations. The average residence time for patient A was 0.08 seconds, the units are in seconds, and for B was just only slightly smaller than that. The average residence time for the main branch decreased by 6%, but increased by 13% for side branch after stent placement in the bifurcation segment. And again, you see here a color contour that shows the distribution of residence time from blue to red, from low to high. Now, we also computed the path lines, the resident path lines, and you can see how they differ for the various subjects. For patient A, the flow was not recirculated or separated. That's in a normal subject, and the streams didn't appear into the lumen. For patient B, recirculation was not significant in systolic phase. However, in diastolic phase, flow was recirculated after the throat of the stenosis. And finally, in patient C, the flow after separation branches had tendency to increase along the inner wall of bifurcation. And then the flow around the outer walls of the bifurcation was relatively low. Now, we also, as a comparator, we contrasted our results with those of the relative residence time, and you can see the results here. The relative residence time and residence time contours appear show predilection for stenosis and restenosis zones similarly. The average RT and relative RT for patient C with stent to compare without stent in cardiac cycle increased 30 and 27% respectively. For the normal patient, A RT and relative RT average and cardiac cycle were relatively similar, 0.25 and 0.19. You can see the relative resonant time. The units there are the sort of inverse of pressure or inverse of Pascal, whereas resonance time is given directly in a time scale or seconds, which is physically easier to understand and interpret. So for patient B, residence time and relative resident time average for cardiac cycle were 0.149, 0.16. We also considered the wall shear stress. The wall shear stress increased abruptly at the throat of stenosis and separated at bifurcation. Wall shear stress decreased substantially when there is separation of flow and recirculation, as is well known. And finally, low wall shear stress and high resonance time regions are, of course, where atherosclerosis or restenosis tend to favor. We also considered a parameter called localized normalized helicity LNH, and it was used essentially to visualize orientation of velocity and the vorticity vectors. The ISO services can detect which stenosis and stent struts may affect flow pattern and cause flow tortuosity. The relative resonant path line showed recirculation and helical flow where the LNH ISO surfaces appeared, so they correlated, and hence we see a relationship between the two. So finally, in conclusion, the resident time and relative resident time are both clinically relevant and can both determine region with high risk of atherosclerosis or restenosis. The relative resident time method allows visualization of flow pattern on lumen for diagnosis of coronary artery disease in early stage. Of course, ideally before stenosis initiation and restenosis progression. And finally, the residence time method can be applied for calculating RT for both blood cells and proteins, because again, that determines the amount of time that cells have near the wall and hence can transport to create potential dysfunction, remodeling at the wall, and atherogenesis. Thank you very much.